Hello students, we will have a case discussion today what this condition is. Look at that foot, there is multiple discharging sinus in the foot. You can see that here, sinus, typical sinus, it's called a sinus. All of you know that sinus is a blind track connecting from the exterior to the inside for any cavity. Maybe it's specific like tuberculosis, malignancy, osteomyelitis, actinomycosis, like that. So what this condition is, there is a point you have to remember. There is some focus. Foreign body also can cause sinus. So this is Madura Foot. All of you know that it is a granulomatous condition of foot involving subcutaneous tissue, deeper plane, whereas it may be bacterial or fungal organism or fungus enters deep into the plane, then from the skin, involves the bone, deeper tissues, comes out as a multiple discharging sinus. Rather, even though benign infective condition, rather distressing disease, difficult to manage, often lasts long time, needs real patience and management policies to cure the condition. So first identified in Madurai by Gill. That's what we call it, the Madura Foot. It can be bacterial, I already told. Actinomycosis israelis, fungal-like bacteria. Nocardia Madurai, that is the commonest thing is bacterial. Fungal is Madurella mycetomia or grissa. Discharging granule, depending on the which organism it causes, red, black, yellow. So that discharge is very typical. Collect the discharge and do a gram staining. You can see the sun ray appearance. That's why it is often called as actinomycosis israeli, typically bacterial type. It's often called as ray fungus because like a sun ray, it is called as sun ray fungus. Gram positive, center is gram positive, and that rays are gram negative. They are called clubs. Now MR is very diagnostic. Dot in circle sign is a typical MRI finding of the Madura Foot. It is often asked as MCQ question. Dot in circle sign is seen in which condition? It is in the Madura Foot. That point you have to remember. Always remember dot in circle sign. Very, very typical MCQ question. And remember bacterial actinomycosis israeli. It is fungal like bacteria. It's not fungus. It is a misnomer ray fungus. It is called as ray fungus because sun ray appearance, sun ray like this. Clubs. It is clubs. Typical like this. Looks like a sun ray. This is the gram positive. These are the gram negative clubs. So that is typical sun ray appearance is nothing other than actinomycosis israeli, one of the bacterial cause, fungal-like bacterial cause of the Madura Foot, which is also common, remember. So that is ray fungus. Therapy, drugs, many drugs are there, antifungal, bacterial, then do the culture and then show the sensitivity and give penicillins are good. And eventually surgery is required, wide local excision. Now worry is a bone is the deeper tufted tissues are involved, often difficult. Severe Madura Foot may require amputation to come out of the distressing problem. And debridement, sometimes amputations you have to do, remember. So Madura Foot is a common short note, KB is oxy, short case, not an uncommon entity. Remember, interestingly, word Madura word is derived from the Madurai city from Tamil Nadu of India. Remember, that is the fascination which you remember, coined by Gill. So answer the MCQ. Foaming liver is seen in which condition? A. Actinomycosis, B. Anthrax, C. Gas gangrene, D. Rat poisoning. So students, please comment your correct answer in the comment box. We'll have a discussion about that later in the comment box. To go through my clinical methods in surgery with video lectures of how to examine different cases and my textbook manual of surgery details everything for UG as per CBM syllabus, and operative surgery in 2 volumes gives everything about technique for all surgeries, major, minor. My DigiNow lectures through JP Publishers gives all lectures as for UGs, everything, surgery, specialties, basic, instrument, specimen, x-rays and images. So students, I hope you understood this Madura Foot topic very well. Thank you very much.